being one of the facilities or one of the entities that have been severely hit by obviously COVID-19 and everything that's going on. Initially, there were so many changes, but let's talk about what's happening now and what's currently happening at the hospital in terms of programs and services, things like dialysis or chemotherapy treatments. What's happening? Are they still going on?
So I guess I can start, Peter, and you can fill in what I've missed. So as everyone knows, on March 19th, the Chief Medical Officer of Health issued Directive 2, which basically told all healthcare providers that all non-essential services, surgeries need to be ceased or reduced to minimal levels. And this was all in a response and an effort to try to contain the virus and to minimize lateral spread. So complying to the directive, Headwaters followed suit, and virtually all elective clinic visits, procedures, examinations were postponed. And so that means elective surgeries, endoscopies, minor procedures, in addition to all non-urgent X-ray examinations, mammograms, ultrasounds, CT appointments, and even extending from that, a lot of our outpatient ambulatory care clinics were also put on hold. And so that's had a huge impact across the hospital, across our community. Obviously, we have recognized that not everything can be canceled or postponed. And so, as you alluded to, we have been running some clinics, and those clinics being essential chemotherapy treatments and visits, emergent surgeries, either through the emergency room or even electively. We continue to provide cancer care through these difficult times, as well as care to patients who continue to have ongoing symptoms that just can't wait. And so those would be symptoms that are deemed life-threatening or a significant risk to health.
Yeah, the only thing I would add to that is when we did get hit by the new directives and everything stopped abruptly, there was a pause in a lot of people receiving their care. It was probably 3 weeks later, we started to look for opportunities where we could restart the visits with virtual consults. And so things like our diabetes program, they were able to start seeing patients again, not in the hospital, but through virtual consults. So there was a pivot that a lot of people found ways to stay connected to patients who were suddenly told they couldn't come to the hospital. Other things that were considered elective or not very urgent, they could be delayed. But like everything, the longer you wait, the more they become urgent to the person. And at some point, we would, as we're now looking at how do we start back up. So we've been adapting to the changes as they've been evolving. And it's a little bit of a challenge at times because we can tell somebody today one thing and then tomorrow it'll change and we have to adjust with the changes. But the good news is that we're always keeping up with what's happening. So as soon as we can start more services, we'll be doing so. And we're in the process of planning that now.
Wonderful. So let's talk about what you are in the process of planning, and can you tell us what you're doing with regards to reopening programs and services that are not available right now?
Yeah, so we've a couple of weeks ago, on the Ontario Health issued an outline, which is an approach to help hospitals and facilities plan for reopening. And so we've had numerous meetings, all the behind the scenes work that people don't see, people hard at work trying to figure out how to open up services safely. We've, meet almost daily, and then more formally as larger sessions, trying to develop a strategic plan to figure out how to reopen these services that have, just been on hold for the past 10 weeks. So, part of this reopening plan, though, is recognizing that we have to be very careful in our strategies, because we don't want to see, surges and spikes in COVID-19. We want to keep people safe, both from COVID, but also keep them safe from their, illness that needs treatment. And so we recognize that while we initially could postpone things for a couple of weeks, as the months and weeks continue, we can't postpone people forever. And as Peter alluded to, what people that could wait in the beginning now can't wait. And we do recognize that. And so we're trying to come up with a plan to be able to offer those services back to the community and to our patients.
Yeah, I think I would add to it. it's even harder now to restart, only because we have a new normal to have to address when it comes to social distancing, how people move through the system. If there are things that are aerosol generating and increase the risk of spread, we have to control for that in the hospital. So what we used to have a room maybe with 30 patients waiting in a waiting room, we can't do that anymore. We have to redesign that waiting room to be socially spaced accordingly, as well as partitions or barriers. The timing of our patient flow will be different than what we used to say to people. They used to come 2 hours earlier to the hospital. Now that just can't happen. You can't wander around the hospital. There's still restrictions on visitation. So there is a very large working group and subgroups that are working on, if I imagine ramping up my services to some degree, what does that look like for the patient moving through the system now compared to what it used to be? And it's a significant amount of work. We also have to be careful of our utilization of supplies and PPE. You don't want to have an unintended consequence of where you have the best of intentions in raising the services, but ran out of something that was essential for somebody else in another area of the hospital. So there's always this sort of interdependence that we have to look at as we're ramping things up. And we also have to do it really in partnership with our community, because good news for us, we're one of the 24 OHTs in the province. So we already have a really strong network of partners in the community. So primary care, home care, they need to be involved in some of our discussions, because again, we could think we're doing minor impacts to the community, and it turns out to be quite catastrophic. So that engagement is essential as we move forward. So there are no assumptions anymore in the system. We have to ask those questions in each case to make sure we're actually not hurting anyone in the process of trying to do a good thing.
Yeah, I agree with that. And that reopening requires a lot of coordinated effort between so many different people, because it's just a domino effect, and it's so complicated that shutting down was way easier than it is to ramp up. But, ramping up is, as Peter said, it's going to be a new normal that we have to deal with, and trying to figure that out as a whole group, realizing there's so many moving parts is tricky.
Yeah.
I can only imagine how difficult it is, just talking from a smaller business and talking about reopening and the maybe the 4 or 5 contingency plans that business may have, whereas something to the magnitude of Headwaters Healthcare Center has so many operating arms and so many things going on that I'm sure the teams are working tirelessly. And I'm going to take this quick moment to thank everybody at Headwaters Healthcare for everything that you're doing at the foundation, the workers, everybody who's there, the cleaning staff. We can't thank you enough for putting our care first, and everything that you're doing for us as a community as a whole. So that is my heartfelt thank you for that. And I'm getting teary-eyed because my mom was just at the hospital. So it's an emotional for me, and everything is great. And now, and she had wonderful health care, and with everything that was going on, like I said, I thank you so much, which I was going to do at the end, but apparently my emotions took over, and I'm telling you guys right now, thank you very much for everything that you're doing for us as a community, and the precautions that you are taking. So let's go back to talking about revamping some of these services. What happens with the people who had elective surgeries that were canceled? How does that work?
Okay. So no one has been forgotten. Okay. And so, unfortunately, 10 weeks of restricted access to care has obviously created enormous wait lists for everybody across the hospital, not just surgeons, but internal medicine docs, family docs, and even x-ray outpatient procedures and examinations. And so no one has been forgotten. So that's the first message that I want to put forth. We all have wait lists. And in those wait lists, we have all tried to figure out how we're going to work through those wait lists. There are some scoring models and some methods that we can use to try to help prioritize that. We want to make sure that every patient has equitable access to care. We want to be, conscious of every patient's needs, and there may be different circumstances for every patient that need to be considered. And so we are working through that. And in that, each of our offices will be, communicating with patients to help provide information and guidance along the way. And then as we get the green light to start ramping up some services, we'll be doing our best to try to move through those wait lists to provide timely care to those most at need first, as we move through the next few months and, even beyond that.
Wonderful. So what can we expect heading into Headwaters? Will there be advanced planning or virtual communications? How is this going to work before someone starts to head in for a procedure, or has that even been worked out yet?
So we're in the beginning phases of trying to figure all that out. As Peter said, everything that we're doing now is a new normal, and that new normal may be different in 2 weeks and may be different in a month. So we take directives from public health, from the Ministry of Health, the Chief Medical Officer of Health. So all these people that we're talking to daily and weekly to help maintain safety for everyone, not just patients, but the entire healthcare team. And so we are in the beginning phases. We are going to be looking at more virtual care options, screening, pre-screening before coming to the hospital, screening when you get to the hospital, protective equipment for everyone involved. So the entire patient journey will be different, no doubt. And we're going to involve patients and families as we try to come up with this new procedure as well, to understand it from a patient perspective. Ultimately, one of our mottos has always been to provide the best patient experience every time. And I think we continue to stand behind that. So that we are early in the discussions. Work is being done behind the scenes to try to figure this out. More to come.
With regards to, we have a couple minutes left, so I just want to talk about the actual staff itself and what's going on there. Everybody's putting in extra hours doing all those sorts of things to make everything work and be positive. What are you doing as a whole to stay positive during this situation? Because I'm sure it can be very overwhelming and daunting and exhausting.
I can answer that question. So, I mean, we're so fortunate at Headwaters with the number of our staff who've really stepped up and been literally heroes in many of the things we've had to do during the last 10 weeks. And that's across the board, our nurses, our physicians. We were one of the first to put the assessment center into operations. And it continues to be really one of the most effective ones in the province right now. We've been very busy through the assessment clinics for people to drive through, but our staff have just been exemplary. Last year the hospital went through a new strategic planning and we renewed our values as a hospital. And they're easy to recite because they live them every day. So it's the kindness, the passion, the courage, and the teamwork that you see in almost every conversation. When we get together, they're all very much dedicated on how do we take care of our community. That's really where their passion is. So, as long as we're always focused on that as our point of reference, they are the first ones to step forward. When we offered help to long-term care, we asked for volunteers to come and help, and we had 30 of them come forward. So, it's something very special when you work at Headwaters. The group is actually unlike what you might find in other places. There's that hometown feeling to people working every day, but we do a lot of impressive things for our community that saves them from having to travel to a much larger hospital. So our cancer program, our dialysis program, our surgical program, a very busy emergency department. So the staff, across the board have been exemplary, and they've been part of the process when we've had to come through difficult decisions, difficult conversations. When there's looming risk of not enough PPE, what are we going to do? And so, I never saw panic. I saw people trying to come up with creative solutions on how to address a need going forward. And, it was a collective effort amongst everyone involved. So I'm really proud of our staff. I feel very privileged to work with the group. And I often I wonder sometimes what happens in other places if they're as lucky as we have been in the last 10 weeks going through this process, because we've had our challenges, but I always felt like we had a team that was ready to step up and serve TV.
Welcome back to this update. Joining us still, we have Dr. Grace Wang and Peter Varga from the Headwaters Healthcare Foundation Center. We have been talking a lot about what's going to be happening in the future. And Dr. Wang, if you could tell us your take on what's been happening, how the staff has remained positive, and the community reaction.
Yeah, so I think, no doubt these past few months have been very challenging for everybody. I think I've seen this pandemic bring out the best in virtually everyone that I've come across, not just staff, but also patients. I think that as a community, we do recognize that this is a global pandemic, and while it's been frustrating at times, as you can understand, people have been very quick to step up and everyone to do their part. Not just staff, but also patients, listening to the recommendations to stay at home and to physically distance from people and to not put themselves as well as other people at additional risk. Like Peter said, we have a phenomenal hospital. It is a community. Everyone wants to work together to support each other. And I think that's what has helped keep us positive, in that we've all come together to work hard and to deal with this current crisis/pandemic. But we've also been quick to praise each other and recognize the hard work that has been done on so many levels. And I think that is really motivating to people, to be recognized for that hard work and for that collegiality. This whole situation in the past couple months has been difficult. So not just at the hospital level and for medical care, but homeschooling and not being able to do sports, and it's taken a toll for everybody. And so I think we've each found our ways in terms of how to deal with it. I think part of that has been we've been able to spend more time with family, and maybe not in the capacity that we could before, but being able to reconnect and be able to, as the weather's been getting nicer, to be able to get outdoors, enjoy the sunshine, take walks, and take that time to look after ourselves, so that when we come back to work, we do have that energy and that motivation that, times are going to get better. We know that right now it's been tough, but I think that's what's helped me at least stay positive and focused on that. This is just a small blip in our timeline right now, and we will work together as we have been, and everyone has shown that they're willing to step up to the plate, and I know that we will get through this, and it may not be the old normal, but it'll be a new normal, and maybe that new normal will be better.
And you're absolutely right. Many of the interviews I've done, we've talked about the new normal and, finding silver linings and services that maybe people hadn't provided online before that will continue to be provided, and give people extra access to whatever service it happens to be. So that new normal, there are some silver linings in what we're experiencing now, and how things will change. So let's go on to that. We've been talking about the reopening of certain services. So do we have an idea of what it will look like with regards to checking into the hospital and the waiting rooms and how that will work yet?
Do you want to go, Grace, or want me to take a stab at it?
You can take a stab at it.
So definitely will be different. Just as you had your own experience coming to the hospital, the restrictions for visitation still are in effect. When Directive 2 gets amended and or there are changes in what we can allow people to come to the hospital, we'll be sure to make sure people are aware of that. But right now, I would say for people's expectations, we're going to try to do as much as we can online, virtually, so that we can minimize the amount of time you're having to be face-to-face with anybody. When you do come, you'll be wearing a mask or bring your own mask, and things will take longer, unfortunately. There's a recognition that we've had, even as we've been continuing to provide those essential or critical services. Things take a lot longer. It takes longer to put on all that equipment in some cases. It takes a certain amount of time in the OR before you can begin the procedures. So I would say to patients that maybe your experience in the hospital, maybe it wasn't fast in the past, but it's not going to be fast going forward either. We're going to try to make the time, though, as efficient as possible. So you should be moving through places, because we don't want people just sitting around in different waiting areas. That will cause us a problem. So we want to have maybe a more streamlined experience for people, but the process itself and different steps along the way will feel longer, I think, at the beginning. Part of it's also learning for us, and we're going to be learning with, as had mentioned, patients actually will be part of our discussions on how to make it better. We're going to have some patient advisors participate on our relaunch committee, and they can help us understand if our planning is going to provide a good experience for them. If people go through the experience and it wasn't a good one, we'd like to know that so that we can keep refining it, because there'll be ideas they have that we haven't thought of, and I think that'll be very helpful. But we hope to see online registration emerge from this in the near future. There still will be screening at the door as patients come through, but you may do a lot of your pre-consultations virtually, and your post-operative and or post-procedures may be done virtually. And that may also include your family physician. It could be potentially one where the 3 people are at one time talking, so that you can minimize the number of times you have to book an appointment. So we are hoping to see a lot more improvements in that respect for patients coming through.
That's wonderful. So I know that the hospital relies somewhat on their volunteers, because volunteers are very important. So moving forward, and I'm not expecting a definite answer on this, but moving forward, I'm assuming that the volunteers will be asked to come back to the hospital to help out when it's safe. Is that?
Yes. So they were as part of our conversations about, critical components of our past practices. They were one of them. They're sort of the unsung heroes at times because you don't even notice them in the background, but they're so important to a hospital. So yeah, they were unfortunately not able to be in the hospital with us during this period. But as we are considering ramping up services, we're asking the question, how can we bring them back? If under what circumstances is it safe? We will be connecting with the auxiliary leads so that we can ask, some people may not want to come back to the hospital till it's a different period of time too. So we're just starting those early conversations to better understand who's interested in coming back, what would it look like if we could facilitate that. To some degree, they do play an essential role, and we have that ability to make that determination. It is not an unreasonable component, but maybe not standing around waiting to direct traffic. That's probably not going to be a role we're going to be asking them to do. But guiding someone who needs extra help towards a surgical procedure, that could be very essential because our staff are busy doing other things now. So, Gracie, your thoughts about it?
Yeah, I think that everything that we do these days is just a balance of, providing services that we need to provide, and balancing that between, the risk of COVID transmission to patients, to staff. I agree with Peter. Volunteers are a huge part of our hospital, and we can't function without them. So we've certainly felt their absence in the past few weeks. They are the backbones, and they help things move along. And as he said, we don't even realize what they're doing and how much they're helping. But recognizing that I think we're still a little bit too early to know definitively what that's going to look like. We would love to bring them back, but when it's safe.
Yeah. Absolutely. And absolutely. Volunteers are extremely important, and it'll be a comfort level for them as well with regards to when they're comfortable, as you mentioned as well. So I wanted to move into, will there be any special provisions made for, elderly patients, young people, or people that have special needs in this time moving forward for when we do decide to open up?
Yeah, so we actually just had this conversation an hour ago at one of our my subcommittee meetings, and we unfortunately in these times have had to restrict visitors to the hospital to minimize risk of transmission and exposure. However, there are, as you alluded to, there are patient populations who do need that support person. So our pediatric population comes to mind, people who have potentially some mental health or intellectual difficulties that need that, power of attorney, that support person to help guide them through and even to understand what's happening. Being in a hospital is scary at the best of times, and we rely on our support people, and so to not have that person would be very, very detrimental to their health. And so I think that we are in the beginning stages again of discussing what that would look like if we, because we'll have to pre-screen those patients as well that are coming in. And so we do recognize that there will probably be more of those support people coming in moving forward.
So moving forward, there are many community partners that you work with regards to community care and that sort of thing. I'm assuming that they are working closely with you to move forward and get to reopening their services. Is that something that you're working? Are they involved in committees as well?
Absolutely. Yeah. From our paramedics to our community care access workers, our family docs, everyone, we're trying to think of everyone under this umbrella that, there isn't any one service or a program that will not be affected. And so we are having weekly meetings and trying to get everyone's opinion and position to see what have we overlooked, what have we missed, so that we can hopefully, make this as efficient as possible.
It's interesting because we're an OHT, we've actually still been meeting as an OHT group, albeit some of our plannings had to be paused because of COVID. But there's some people might call it an overlap, but it's the integration that I'm sitting at a table where they're talking about what's happening in the community, and they're sitting at our table as we talk about what's happening in the hospital. So, that integration in Dufferin-Caledon is actually one of our strengths. And I think, when we think about launching the hospital, we know it's not us at our discretion by ourselves. We know our partners play a tremendous role in taking care of our patients. And so as we develop our plans, they'll have the opportunity to provide input. And as things are happening in the community, we'll be able to offer our assistance to them so that the community as a whole benefits from the integration of our partners in dealing with these changes now as we move forward. Because it could, again, be a very easy unintended consequence. You do something well at the hospital and it becomes a real challenge for people in the community. So we obviously don't want that to happen. So they participate at the table, and they will give us guidance onto how we can introduce or start to ramp up our services without causing chaos or confusion or disruptions to what their capacity and ability to provide care is too.
And I think that's really important, is gaining from each other's experiences, gaining from everything that's happening, and kind of putting that all together, because one or two people or a committee cannot see absolutely everything that's happening. So having those perspectives are extremely important.
And I think the other thing is there's a lot of inter-hospital and city talk. So we're trying to learn from our neighboring communities to see, well, what are they doing? Have they figured out something? Did they think of something that we didn't? And so through this whole process, the one thing I've learned is that communication has just been paramount to learn from each other, because this is new. We, most of us haven't really had to live through anything like this before. And, we can't possibly be expected to figure it out on our own. So I think collaboration is key, not just in our community, but through other communities across Ontario.
I think that's absolutely important. So let's just talk a little bit about moving forward in the long term. I encourage everybody to be flexible and to understand that these changes are going to change. Anything that you may be thinking now may change in a week, in a day, or possibly in a month. Is there any advice that you would give to everybody out there with regards to the ever-changing and fluid situation that we're in until we get to that finally other side?
I would say, first of all, thank you to everybody for being patient, for understanding. We are all in this together. We've heard that over and over again. These are difficult times, and I think everyone understands that. So I do thank everybody across the community, across the hospital, for the part that every individual person has played. I think moving forward, we are working hard to try to reopen, to relaunch our healthcare system. It is going to be new. We, are talking with a lot of local experts, regional experts, to figure out how to do that safely. And we'll try to do that as quickly as we can, recognizing that these services are important, and we want to be able to provide that back to our patients and to our community.
Well, I want to thank you very much, both of you, for taking the time, because I know your schedules are incredibly busy, for sharing this information with us. And we do invite you back when you are ready to announce what services and how it will happen. Welcome back. Joining us now, we have Rita Isley. She is the Director of Community Health and Wellness and the Chief Nursing Officer for the Dufferin-Wellington Guelph Public Health Unit. Thank you so much for joining us.
Thank you for having me here today.
Wonderful. So let's start talking about the current status in our region right now with COVID-19.
So to date, in all of our areas, Wellington, Dufferin, and Guelph, we've had a total of 370 confirmed cases. But what's the most important piece to recognize is that we're seeing a significant reduction in the number of positive cases day over day. I think around the peak period, we were seeing over 90 new cases in a given day. And yesterday we saw 3 new cases. So that's a drastic difference, and it's what we want to see. So it's quite comforting to see that reduction in the number of positive cases.
And that is absolutely remarkable. So that's just a reminder, don't become complacent, still be out there doing your physical distancing, washing your hands, doing everything we can do to protect one another so that we can get those numbers down to 0. But that is a very reassuring and very comforting number for sure. Thank you for that. It's a great way to start an interview, is with great news for sure. So now that we've got some of the businesses opening up and people are going back to work, what should people be doing knowing that things are going to be changing? They're going to be going into stores and going back to work?
Well, the main reason why we've been able to get that number down to 3 and really stop the spread of COVID-19 is because we have been staying out of the public and not going into stores unless absolutely necessary. And even though stores are opening up, I don't want people to drop their and think everything is fine. We still need to maintain social distancing. And so going into stores, it's really important. Number one, and I can't stress this enough, washing your hands, washing your hands, washing your hands. Especially when you leave a store or a business. But the other things that we have to make sure that we do is we need to make sure that we practice social distancing. Now, stores have been given direction on what they must do by our government, what they must do to open. And saying that, they also have to do their best to control the public that's going in. But as the public going in, you and I going into these stores, we also need to make sure that we do our part in social distancing. If you go into a place, for example, we've heard of garden centers or other types of stores where people have gone in droves and it's really difficult to social isolate. You need to make the decision to leave that place or to come back at a different time when there's not as many people. So we as a society also need to enforce some of those rules ourselves. If we can't enforce it on another individual, we need to enforce it on ourselves. And then finally, to protect others, especially the most vulnerable, if you aren't able to create an environment where you're able to social distance, you should be wearing a mask, a cloth mask, what have you, or a scarf to cover your mouth and nose to prevent your germs from going out into the public area and someone else picking up on it.
And that is sound advice for sure. And let's talk about asymptomatic, because we tell people to wear masks for the protection of other people because you could be asymptomatic. So you could be carrying the COVID-19 or the coronavirus and not have any symptoms, which is what asymptomatic means. So now recently there's been an announcement that with regards to testing, it's been opened up to include asymptomatic risk factors. So can you explain to us what this means and if it will increase wait times at the testing center?
So being asymptomatic just means that you actually don't have any symptoms whatsoever of COVID-19. And those could be the classic symptoms of fever, cough, feeling unwell, to having upset stomach, feeling unexplainably tired, those types of things which are not your classic symptoms. Asymptomatic means I feel like I normally do every single day, nothing new or anything has changed. And we're interested in finding out who is asymptomatic because they're the ones out in the community that are potentially spreading the virus unintentionally and unknowingly, because they don't have any of the symptoms that we started our pandemic toting and talking about. Stay home if you have symptoms. So now we want people that are asymptomatic, who either have been exposed to someone else or even haven't. If you're just concerned about whether or not you have COVID-19, we're asking you to go get tested now.
Okay, so we're talking about coming into close contact with somebody. Mm-hmm. And so, I may come into close contact with somebody, but not have any physical, we haven't touched physically or anything like that. So when we're talking about coming in and that fear or that anxiety that may give people that they may be asymptomatic, when should they get tested and what does it mean close contact? Does it mean actual touching or just being in the same room?
So close contact has varying degrees of definitions, depending on the setting, depending on what was the activity or what were you doing when the contact occurred and the duration. So for the most part, we're talking about close contact when you are less than the 2 meters distance away from an individual for a period greater than 15 minutes. And particularly if you were providing care to that individual, whether it be from a nursing perspective, providing nursing care without proper protection, or even from the perspective of taking care of an elderly family member, helping them eat their food, those types of things. So with with that in mind, if you think that you've been in close contact with someone for an extended period beyond 15 minutes where you have concerns, we're asking you to go get tested, and you would be asked very specific questions about that contact so that they can determine whether or not we need to, from a public health perspective, need to reach out to that person or other people that would have been in that same situation to determine if they need to get tested and if they need to either self-monitor or isolate.
And with this added feature, I guess, or added testing for asymptomatic people, I'm going to assume that that's going to mean an increase in wait time, and that we're going to ask for patience from those who are in line waiting.
Absolutely. So we were at a point a week and a bit ago where we weren't seeing a lot of people coming to the testing centers simply because they didn't meet the criteria at the time for testing. Now that the criteria has pretty much opened up, anyone that wants to get tested can get tested. We have seen the wait times increased significantly in the last couple of days, and our testing centers have all been working very hard to meet that increased demand, and will continue to do so until such time that we don't need to have to be testing at the levels that we are. So there's that wait that people might have to experience, is just waiting to get tested. The second part is that over the course of our COVID pandemic response, we've had multiple periods of time where we've had extended waits from the time that you get tested to the time that you get your results. And there's a whole variety of reasons for that. That could be, at one point, it was the lab's capacity. At another point, it was the ability for the health units to manage the results when they received them. And then there's been some challenges where with the new labs coming into play, where they would receive results, and then those results, receive swabs, and then those swabs would have to get transferred to another facility. So it would delay getting the results because the originating facility wasn't able to process them. So they had to go to another lab to get processed. We are seeing on average about a 2-day turnaround to get results. And what we're also noticing is that the public who are able to access the portal are getting their results before public health is actually receiving results. Both positive, and public health used to receive negative results. Now we don't, except for in very specific circumstances. And so with that in mind, we are directing the public to go to the portal as much as possible to look for the results.
Okay, and that, I all of the work that public health and everybody involved on the front line is doing is absolutely phenomenal, and we all appreciate everything that you are doing for us to keep our community safe and healthy, and to keep those numbers down. So we thank you for that, definitely, for sure. So let's talk about somebody who's experienced the coronavirus. Is there an average recovery time?
Unfortunately, no. So we know of cases that have gone on for several weeks, and there's lots of reasons, underlying reasons as to why that might be the case, and some of them are directly related to that person's health at the time in which they contracted the virus. So if they have underlying medical conditions, if they have, if their body was recovering from surgery, for example, or if they had really, they weren't as healthy as they potentially could have been, their recovery time could be delayed substantially. And you see that with certain populations. Like if you take a look at some of our statistics, you'll see that the majority of the people that tested positive, the majority of the people that succumbed to COVID-19 were over the age of 70 or 80, lived in long-term care facilities, and had underlying medical conditions. And that's just the nature of most viruses that we see, because we would see something similar with influenza, to say. The other part of this is that some people have no symptoms or such mild symptoms that we don't even know how long they actually had COVID-19, because they never really got tested, because they didn't have any kind of symptoms, and then all of a sudden, for some reason or another, such as a workplace requirement to get tested, they get tested and they find it, oh, I have COVID-19 and never knew it. So we don't even know how long they've had it for. So it's a very difficult question to answer right now. I think as we continue to respond to this pandemic, that we're learning more every day. Like even from the end of February, when we were first preparing for and responding to COVID-19, to where we are now, how much we've learned about this virus has changed so significantly. And I just anticipate the months to come, we'll just learn more about it.
Well, we have about a minute left, so I have one last question for you. So anybody who has had COVID-19 and has gone home, do they have to take extra precautions? Do they have to self-isolate? And do we know, can they get it again?
Okay, so the first part of your question is if you are diagnosed with COVID-19, yes, you must isolate. You must isolate for a minimum of 14 days from the symptom onset. So you could be symptomatic for 5 days and then decide, this is weird, let me go get tested. You're going to be in isolation for the 14 days since your symptoms started. And then we don't want you going out into the public, going to grocery stores or anything like that until after the 14 days, plus you don't have a fever and your symptoms are resolving. If your symptoms are staying the same or you have a fever, we want you to stay in isolation until those two items start to resolve, just because you could still be contagious and we don't want to spread the disease. In regards to whether or not you can get it again, that question is still up in the air. There is some strong evidence that's demonstrating that there is immunity after you've gotten COVID-19, but we don't know how long the immunity lasts for. We don't know if everyone develops immunity or if there's only certain sections of our population. It is another area that is being heavily investigated as we speak, so that we can figure out things like what are the components that we need to put into the vaccine while we're developing vaccine or attempting to develop a vaccine for this virus.
A, go to kidney.ca.
Let's just make everybody aware of the services that Big Brothers and Big Sisters offers before COVID-19.
So we had 4 main programs. We have our core Big Brother, Big Sister program, where a volunteer meets with a child for once a week or once every couple of weeks. We have had several school programs. We had a one-on-one program in the schools where a volunteer meets with a child called the in-school mentoring program. And we also have group programs at the school called Go Girls and Go On, Game On. And then finally, we also have had a group program for children on the waiting list for a Big Brother Sister. So we would take them ice fishing, or we took them to the park for hikes and things like that. So so those are our 4 programs.
So how did the coronavirus, COVID-19, affect what you're able to do? Because everything you do is very physical and together.
Yes, that's right. So, of course, our school programs had to end, but our core Big Brother, Big Sister program keeps on going. In fact, it's now even more important than before for our matches to continue to stay in touch with each other. It offers a lot of support to children who are finding it a difficult time to get through the pandemic. There's kind of a mental health aspect to the contact that they do have with their Big Brother, Big Sister. Of course, all of it has to be pretty much virtually now, given our current situation. So we're offering that. We're also encouraging our volunteers to really support children with their online learning to stay on top of the education aspect. And finally, we're also reaching out to our most vulnerable families and making sure that they're okay and getting the services that they need during this time.
Well, that's absolutely wonderful because, and you touched on it slightly, but I mean, a change like this that none of us had ever considered would ever happen. How does that affect the kids themselves? Like what type of effect does it have for them to be a part of such a wonderful program and then it's change?
So, well, I think for many of the kids, they really rely on the relationship that they have with their Big Brother, Big Sister for a lot of emotional support. They also, enjoy the activities and the experiences they can have with their Big Brother, Big Sister. So, of course, some they can't do all those same things that they could have before. But having somebody who listens to them and helps support them during this time is very important and can go a long way to help them get through this time.
So moving forward, after we get up to the other side of this, and we will, how do you think this, will there be a new normal for Big Brothers and Big Sisters, do you think?
Yeah, we're trying to figure that out right now, what that could be. With the concern there could be more waves of the pandemic. So we will rely on virtual mentoring. We're hoping that we can make more regular matches, physical one, face-to-face matches, but then they may have to go back into virtual mentoring again. So it is it's a big discussion we're having all across the country for Big Brothers, Big Sisters. What is the role of virtual mentoring in matches going forward?
And I think that most people I talked to, I would say almost 99% of the people that I've spoken to so far have talked about there is a silver lining that they found, a way to operate that they never thought they would have to, that maybe they will moving forward. So once we're through all of this, and hopefully there are no additional waves, do you think that have you found that silver lining, a different way to connect matches maybe that may not be able to connect physically in the same room?
Yeah, I mean, part of the problem is for some of our kids, they don't have a lot of great access to internet and things like that. So that puts a whole nother problem onto it as well. I do have to say though, the silver lining perhaps for the pandemic may be that we see people interested in volunteering. So it kind of shifts what people might have thought was important before to helping community and helping through our program. So we've definitely had some inquiries from very interested and very, volunteers that are interested in doing that. So we're hoping that happens.
And I know in the past, before all of this came about, a lot of your fundraising, you're a not-for-profit, so you need fundraising in order to operate. And now that this has happened, the fundraising that you were doing is not available. How has that affected you, and what have you decided to do about it?
So for us, we actually get quite a small amount of our income comes from government funding. It was these community fundraising events that we do. So for example, we just before COVID broke, just about 2 weeks, we were meant to have our Bolt for Kids' Sake event just about 2 weeks after the pandemic started. So it would have been our 40th anniversary as well. So that was quite something to try to manage. Luckily, there was quite a few people that continued to support us. Many of our sponsors allowed us to keep the sponsorship money. So we made about not quite half of what we made last year. So at least that was good. That was something. We normally would have a golf tournament in June, which of course we can't do. However, we do have one fundraising event. We are still trying to sell raffle tickets for our WestJet raffle. So if anybody wanted to support Big Brothers, Big Sisters, we think that the chances of winning will be very good because we weren't able to sell them at Bolt for Kids' Sake or at a golf tournament. So the tickets are $20 each, or 6 for $100. And you can go to our website at www.bigbrothersbigsisters.ca/Dufferin if you would like to contact us to buy a ticket. That would be really helpful.
Absolutely. And are there other ways that the community can help? Is it just buy the raffle tickets, or how else can we help you?
Well, people can make a donation. That's always a wonderful thing too. And if anybody wanted to volunteer during this time, that would be wonderful for them to think about that and see if that would be right for them.
That's fabulous. So what have you been doing in all this time? Because I know no matter who I speak to, especially at the very beginning of everything, there was a scramble to say, oh my goodness, how are we going to make this work? How do we stay around? How do we keep doing what we're doing? How do we keep helping people? So that there was that. And I think for many of us, this is actually a busier time than when we were actually just doing our regular job beforehand. So what are you doing to remain sane and to keep your wits about you in this time?
I have to say, I'm really delighted that Island Lake is open again. You can go out for walks and hikes. That's a huge boost. And also, just staying in contact with family and friends during this time is really good too. There's definitely a different feel, like a different pace during this time than there was before.
Yeah, absolutely. Let's talk a little bit about you. So Nancy, you've been doing this for a while. How long have you been with Big Brothers and Big Sisters?
Oh, I think it's like 16 years now. Mm-hmm.
Oh, wow. And what when you started, what were you doing?
So, well, I was hired as the bookkeeper back then, and the executive director was leaving, and they asked if I would take over until they could find somebody else. And I was able to run both for KidSafe during that time, and eventually I became the executive director. So it's been a wonderful job. It's been a really rewarding and a beautiful job to have.
Well, you do an amazing job at doing what you do. So let's talk a little bit more about the matches and how you determine who matches with who. How does that work normally? And also, how does it happen now if somebody wants to volunteer? What happens?
So we, of course, we serve Dufferin County, plus also into Erin and Tottenham and Dundalk, places that aren't being served by anybody else. So generally what we would do is we would think about a location, because we want it to be an easy driving time for the volunteer to go pick up the child. So we think about that. We think about the personalities of the child and the volunteer, and mutual interest, and we look at that as well. We actually put quite a bit of thought into it, because what we really want to do is to make the most long-lasting and impactful relationship for the child and the volunteer. So, and then of course, once the match is made, then we stay in contact and we continue to try to help to usher that along in a way that will be really a good relationship.
So we talk about how this benefits the kids, and there's many different ways, and I'm just going to mention a few, whether it's just the mentoring, the building of self-esteem, just the relationships that are being built. But let's talk about, how does the big brother or the big sister, what benefit is to them to be a part of the program?
Well, as we all know, when we volunteer and do things for others, it really comes back to us. Like what we put out in the world comes back to us. So the people who volunteer with us will often say to us, I don't know who's getting more out of the relationship, me or the child, but we'd love to hear that. And that's not uncommon that we hear that. So it is a wonderful thing, to see the child grow and to become, to be more confident, and through the support of the Big Brother, Big Sister is a wonderful experience for the volunteer.
And so if somebody were to volunteer now, and then they get matched, and obviously it's going to begin virtually, does that create any challenges, or is that, because normally you would meet face to face and be a part of it. So what kind of challenges come up?
Well, we're trying to figure that part out, if we will be doing virtual matches or not. It looks like to make a new match, certainly the matches that are already happening are virtual, but we are hoping that with some restrictions being lifted, that maybe there can be hikes outside and socially distanced meetings between a big and a little. And we're hoping that maybe in the future there can also be, we can continue our same screening and matching, being able to meet face to face. It is very possible. We can do a lot of the screening and the interviewing virtually through Skype calls and Zoom calls and things like that. So, but it depends on how things go. If things are going to start to lift more and more, we will be able to adopt many of our old ways of doing things. We're not a large office with many people, and the interviews be one-on-one as well. So it's in that sense, we may be allowed to operate more quickly than some other organizations. But of course, it all has yet to be seen, right? And whether or not there's more waves that come and how that affects us as well. But if anyone would like to volunteer, we'd be delighted to have them, and we will start the process of screening them and matching them over time.
And that's a big part of it too. This is a very fluid situation. We don't know what's happening. So like others, do you have contingency plans if we get pushed back and, the numbers rise and the Premier says, you know what, we're going to take a step back. Do you have contingency plans for all of these different scenarios as well? Or you just meet and you decide what's going to happen and it works a little more simply maybe?
So we'll have to see. We haven't really, there's not very many of our matches that have even had social distance meetings this time. They've all been doing it virtually, pretty much. So we would hope that maybe through the summer they can start to have some actual one-on-one meetings. And then, of course, if we did have another wave, then we would have to go back to tell them to just do virtual mentoring again. But if it really lasts, we will have to recruit volunteers, screen them, and do actual match meetings virtually as well, which is all possible, can all be done. So anyways, we have ways of adapting and continuing our program.
Absolutely. So let's just bring up the details one more time because I want to make sure everybody's aware of how they can get a raffle ticket and what the best way to do it is. If you could tell us again just before we leave, because I want to make sure that anyone who's able to help can.
Okay, so it's the raffle will take place on June 11th, and we have 2 tickets with WestJet wherever they fly. So the way it will work is the tickets will be good until June 11th, 2021. So people, hopefully everything will be open and you can fly anywhere that WestJet was flying before. We'll have to, anyways, we're hoping that will happen. The second place prize is a big screen TV, and the third place prize is a $200 Best Buy gift certificate. We have a lottery license to sell 350 tickets. I don't know, it's unlikely we will sell that many. At the moment, we're hoping for 200, so the chances of winning are very, very good. So a single ticket is $20. If you would like to spend $100, you will get 6 tickets. And to buy them, you can email me. You can go through our website, which is www.bigbrothersbigsisters.ca/Dufferin, or you can email me directly, and you can pay with either e-transfer or you can set up a time for me to take your credit card over the phone. But so my email is nancy.stallmach@bigbrothersbigsisters.ca.